that up to you.
Yeah, sure. Good morning, ladies. I'm Dr. Mina. I'm a pediatric dentist in Dr. Joy Dental Clinic, the Meredith branch. We have 6 branches all over Dubai. We have one in the Palm, 2 in Jumeirah, one in Charopeme. Meredith, we have Karama, and we have it also in Burjama. All of our centers, we have a pediatric dentist on board. Pediatric dentist, before I start, I need to tell you, we are totally different from adults dentistry. We see things in a different perspective. For the first year, we studied only the psychology of the child. So we see even our ways to approach the kids is different, everything is different. Just a question, how many of you are already mothers or new mothers, and how many you have other kids, if you don't mind? You have how old is your?
20 months.
20 months, okay. And all of you are mothers, or you're going to be? God bless, congratulations, wish you all the best. So today I'll speak to you about how important and why is it to preserve the teeth for our kids, okay? So do you guys know when is the first tooth usually erupts?
6 months.
6 months, yes, you're right. Usually it's the first lower teeth. It's usually the lower teeth will erupt around 6 months. We always say plus or minus 6 to 12 months. So sometimes you will see the kids are a bit late. Please do not panic, that's normal. Until 1 year old, especially boys are usually late than girls. That's totally normal, okay? So just to brief out, so this is the baby teeth, so just for your own information. So usually the first one comes at the age of 6 to 10 months. See, as I told you, it's a different age from between 6 to plus or minus 6 to 12 months. So first you get your incisors, then usually get your uppers, and then you get the laterals, then the canines, then the first molar, then the second molar. It doesn't have to be that pattern. It's normal. It's just sometimes they're funny. Okay. Does anyone know what's the signs and symptoms of teething? Yes. they just, especially at night, the first thing, they're crazy at night. They're crying and you don't know what's going on. So that's normal. Biting, you just feel they want to bite and they grab anything in there and just anything in their way. Okay? It's biting, it's sometimes also increased drooling, so nothing to worry. Sometimes it's very rare to see rashes around the mouth. That's totally normal too. Increased sucking, so sometimes increased sucking, and we'll talk about sucking in a later. Very rare, but it happens sometimes. It's ear pulling. It's very rare, but please, if you see it's not normal, ear pulling sometimes is related to ENT infections. So please, if you feel it's too excessive, and if it's not matching the chart of the teeth, just check with your ENT, please. Okay. As I told you at night, so it's difficult sleeping. The child is not happy. He's irritated. That's normal. Diarrhea, not for more than 2 days. And the most important is increased body temperature. But please, for the increased body temperature, if it's more than 38.5 degrees Celsius, I'm talking in Celsius, if it's more than 38.5 and more for 2 days, it's not teeth anymore. Please check your pediatrician. Okay? Now, the baby teeth is very important for a couple of reasons. The most two is it helps in chewing, and of course they look nice, okay? And also it acts as a natural space maintainer. I just want to show you a video, yeah? So this teeth falls by the age of 12, this falls by the age of 9, and this falls by the age of 12 again, yeah? This is the first permanent molar that comes at the age of 6. Just imagine if you lost one of them, look what happens. Just imagine this is lost. See how the teeth starts moving? And then you need to do a space maintainer, but prevention is better than cure. You need to put this. Why? If I can just save the teeth. Okay? So this is now the permanent eruption of the permanent teeth. So that your child will keep erupting his teeth till the age of 12. So this is at the age of 6, again plus or minus to 6 to 12 months. And then you have, again, the laterals on the 7, the canines at the age of 10, the first premolar at the age of 10 or 11, sometimes even 9. The second premolar is 12 almost, and the third molar, the wisdom tooth, of course, not everyone, but at the age of 18 years old. And not all kids have, not all people have their wisdom tooth. That's totally normal. Do you think that cavities gets affected for the baby teeth? Sorry? Yeah, thank you. It's a yes, okay? Just what is caries? It's an infectious disease, okay? It's an infectious disease. It's exactly equivalent to asthma. Like out of 10 kids, you'll find 8 kids having cavities. And it's the number one by research. What I'm saying is by research. It's the number one cause kids skip school is because of the dental pain. Yeah. This is an example of early childhood caries. It starts with you with a white spots lesion, and this is like the first stage. This is the second stage, this is the severe stage. This happens for 2 reasons. Bottle milk, formula milk. I'm not saying stop formula, I will explain about this in a second. Also even breastfeeding mothers. Okay? Can it be prevented? Yes, it can be prevented. Okay? So just to explain more, what is the cause of the cavities? There are 3 main reasons. It's the bacteria, it's your oral hygiene, and the duct. Okay? Bacteria, no one can control it. It's like someone has a good oral hygiene, strong immunity, and some people have low immunity. This you cannot control. Second is the oral hygiene. So when I say oral hygiene, I'm speaking about how many times you're brushing your teeth, the way you're brushing, the toothbrush, the type of the toothpaste. When I say type of toothpaste, I'm talking about the fluoride toothpaste. If you're flossing is 40% of your cleaning, and even tongue scratching. Just to summarize it, what's the cause of cavities? You have accessory sugars in your meals. You have the enamel quality, the type of the teeth. Sometimes it's not your fault, it's not the child's fault, it's the way the teeth is brought up, is formed. And then you have, if you're not drinking too much water, the lack of fluoride intake, and the irregular oral hygiene measures. So it's all correlated. So if you just go back to the back slide, just imagine this is your tooth. Yeah? I just need 2 of this to be affected. So if I'm having strong bacteria, but proper diet, I'm good to go. But if I don't have oral hygiene, it's gone. I started having bacteria. So it's all related. See, it's all related together. So if this is not controlled, if you cannot control these 3, you start having cavities for it. Can caries be prevented? Yes. As we all know, prevention is better than cure. How? By following the oral hygiene methods. Okay? Brush your teeth, brush the baby's teeth for twice per day. The rule is called 2 by 2. Twice per day for 2 minutes. Okay? Flossing is 40% of the cleaning. I know the second question I'll ask, that my kids doesn't have teeth close together. You know your child, just have a look at the child's mouth. If you see there's gaps, I'm fine. If there's no, you need to floss. You need to floss. Okay? Tongue cleaner, if you can. I know this age is a bit hard, but try to train them. And I'll speak about that, okay? Also, please rinse with water for 30 seconds. And if you have any age above 6, please start using anti-caries mouthwash. Vitas has an amazing product called anti-caries mouthwash. How to promote, how to have oral hygiene instructions? It's like 3 steps. The first steps I would say, promote healthy eating. As I can see now, you're giving veggies, fruits to your kids. Whenever possible, try to give fresh juices at home. And even if you give them the packed one, or the milks, or the strawberry milk, or the chocolate milk, try to give them, please, with a straw so that it enters straight away to the gut, so it doesn't stick on the teeth. And what we do advise also, please, even for you adults, if you have I'm a heavy coffee drinker, okay, just have a sip of water, go like this, and just swallow it up. So it raises all the sugars and the acids of the sugar and of the fruits. Yeah. Dental checkups. I'm sorry, I skipped one thing. If your child, and if you agree, if you have chewing gums, if they like chewing gum, please give them sugar-free extra because it really promotes to decrease the cavities. Okay. The dental checkup, it has to be every 6 months. Even for adults, it has to be every 6 months. You have to do their checkup, their cleaning every 6 months, fluoride every 6 months, clean X-rays if needed. And your child needs to visit his dentist when he's 1 year old. Okay? So dental tips. Start using the brush when the first tooth erupts, and I'll show you a nice video now. Start using fluoride toothpaste when you see the first tooth coming out. So once you see the baby tooth, the central incisor, the lower one, coming out, start using immediately a fluoride toothpaste. Okay? At the age of 1, start using a semi-cup. I was just talking with Cecile about the pacifiers, about the bottle feeding, about the semi-cup. I know it's a bit hard, but try it at the age of 1. Please start using semi-cup. I'll explain to why. Please, your pacifier is your worst enemy, and I'll show you why. Try to stop by the age of 1. Maximum is 2 years old. You have to stop.